Tonight, we begin a week-long series looking at the opioid epidemic, a serious issue around the country. The CDC says each day, 91 people die from overdoses. 91. Senior correspondent Rick Leventhal tells us where we are right now and the surprising way this country got here.
On any given day, the Warwick, Rhode Island Fire Department's Rescue 1 rolls on a dozen calls. Traffic accidents are routine, and so are overdoses on opioids like heroin, fentanyl, and oxycodone.
And we spray this up into the nostril.
Rescue Lieutenant Henrik Dunleavy shows one of the methods for administering Narcan, a life-saving drug for opioid OD. He's seen a dramatic uptick in addict rescue calls in his 17 years on the job, and sometimes saves the same people over and over again.
They're this close from dying, and then you get them back with Narcan, and they're awake, and they're talking, and they're like, oh, no, I didn't do anything, and then finally they admit, oh, I was doing heroin. Okay, well, don't do that again. And then, like, next week you come back, and there they are again. And you hit them again when I can get back. I'm like, what are you doing?
The worst drug-induced epidemic in U.S. history.
Bertha Madras is a neuroscientist on President Trump's opioid task force. She says the crisis traces its origins to a pair of studies in the 1980s, including this one in the New England Journal of Medicine, which declared addiction was rare for patients treated with narcotics. Pharmaceutical companies launched aggressive campaigns promoting powerful meds like Vicodin and OxyContin. There was movement to name pain as the fifth vital sign, and physicians began writing hundreds of millions of prescriptions based on what Madras calls poor science.
Nobody had done long-term studies on treating chronic pain with opioids. There was nothing in the literature.
You can't overstate the pressures that were put on young physicians in the late 80s and early 90s to treat pain, not just adequately, but aggressively treat pain.
Dr. Michael Dacey is the president and COO of Rhode Island's Kent Hospital. 3 ODs arrived by ambulance in the hour or so we were there, 2 more the next day. Dr. Dacey says the medical community was misled, but it shares responsibility for this deadly scourge.
You had a combination of people fervently trying to do the right thing at the same time as these more potent, newer forms of narcotics like OxyContin came along that were marketed initially as being not as addictive. Turns out they were at least as addictive. So you had this perfect storm coming together, and as physicians, we own a piece of this.
In upstate New York, the opioid epidemic forced Syracuse Behavioral Health Care to dramatically expand its facility.
We serve a couple of hundred patients. Now we're serving over 900. And that isn't enough. We're literally bursting at the seams.
The opiate treatment program distributes methadone and other drugs through dosing windows with nurses and counselors on duty around the clock. Because CEO Jeremy Klemanski says if addicts don't get immediate treatment, they will die.
We don't debate whether or not someone with chest pain would likely die if they didn't get into an emergency room. We don't debate whether a diabetic left untreated would really die of their diabetes and when. But for some reason in this sector of healthcare, sometimes there are people who want to debate those things. And the reality is the debate is over.
The number of people who die in the U.S. from drug overdoses every year is staggering. 52,000 in 2015. That's more than car crashes and gun homicides combined. In fact, opioids alone kill 91 Americans every single day.
The pain that pill caused me is a trillion times worse than any pain I would have endured, I'm sure. Go on.
Nathan Wendelowski got hooked on Oxy after surgery and eventually moved on to heroin, in and out of rehab for 10 years.
Why didn't it work? Why the first time, the second time?
I didn't think I could do it. I just kind of was like, I loved it. It was my everything. I loved it more than my family, more than my job, more than my friends, more than my girlfriend at the time.
He's been sober 4 months and says the substance abuse program at Butler Hospital saved his life.
How do you know that you're not going to go back again?
I take it one day at a time.
Yeah.
And I see people dying all around me, people very close.
Yeah.
I have more people died that I know than I have fingers and toes.
Right before I left, the nurse or the receptionist said, "Ooh, honey, wait. I bet you're in pain. Let me have the doctor write you a prescription." And I'm like, a prescription for what?
Danielle Amaral says she got hooked when she was still a teenager after she went to the dentist to get her wisdom teeth pulled. Years of abuse later, she's taking another drug, Suboxone, which cuts her craving for Oxy and helps her live a sober life.
You think of addiction, you think of like a street drug and crack houses and scary places, and it's not. It's not. They're everyday people like that had no idea.
Nathan carries a clipping of a lost friend as a reminder of what could happen to him. There will likely be at least 50,000 similar obituaries this year. In Providence, Rhode Island, Rick Leventhal, Fox News.